Did you know that there are people who consume antacids daily? Omeprazole, esomeprazole, and other antacids without prescriptions. And it means that this trend will keep going forever, because if you are treating something just because you know medication and it keeps coming back again and again without you really finding the root cause of that particular problem, then automatically you are wrong. Now, one thing that I want to stress today is stop treating ulcers. Stop using acid medications. You have a bad taste in your mouth. You feel nauseated most of the time. You feel like you want to vomit. There is the sensation of a full stomach. All through you feel you are full, you feel you are bloated, and when you go to defecate or you go to have a bowel moment, you feel like you are not fully relieved. You feel like the thing did not come out wholly. So you belch most of the time, you have a decreased appetite, and mostly the pain in your stomach is something that you have made peace with. You always know that my stomach has to be this painful. If also you have heartburn most of the time, and sometimes when you sleep you can belch, and when the reflux comes back to your mouth, especially when you're asleep, you feel it's acidic and even hot. If you have these symptoms, kindly consider doing a H. pylori test. What is H. pylori? H. pylori is a bacterium. It is called Helicobacter pylorus. This bacterium enters the body through the mouth. Then it moves through the digestive system, through the gut, downwards, and infects the stomach. Unlike other bacteria, H. pylori bacteria can survive in a harsh acidic environment, such as the stomach acid. Now, you know the stomach within the stomach we have gastric juice. We also have HCl, hydrochloric acid, and you can imagine the H. pylori always stays safe within that acid, and that is supposed to mean they produce a substance that neutralizes that stomach acid. Now, get this right. The substance that neutralizes the acid that comes from that substance that comes from the H. pylori will not help you. It will not neutralize the acid for you so that your stomach works best. It will neutralize the acid for itself. And remember also, we don't need neutrality in the stomach. We don't need a pH of 7 in the stomach. We need acidic pH in the stomach for digestive process or digestion to take place perfectly well within the stomach. So, H. pylori is actually a classic symbiote in that it can persist in an individual's stomach for very long. You could have this for over 2 years and you keep treating ulcers day in, day out. And a lot of people have this misconception that the moment you have an issue with your stomach, it's always ulcers. That is, ulcers does not just come easily the way people take it. An ulcer is a sore. A sore ni kidonda. That ulcer needs time to heal. How will you even know that you have ulcers if you didn't go for an endoscopy or even a colonoscopy? If you must confirm that you have ulcers or sores, then you need to go for a serious endoscopy. You get checked, you are told, we have seen the ulcers. But if you just have issues with acid in your stomach, then that could not be an ulcer case. It might not be a case. So, if you have H. pylori and the H. pylori bacteria multiplies, and it takes a longer time without you realizing you have it, then it is the one that is responsible for causing perforations or inflammations. Now, these inflammations will finally become sores, and these sores are what we call now the ulcers. This happens in the lining of the stomach or in the upper part of your small intestine. So it is through this that we get what we call gastritis. Gastritis now is the inflammation of the whole of that gut. It is inflamed, the mucosa lining is inflamed, and then this, if not treated, can always lead to stomach ulcers, stomach cancer. A lot of us, those who have got stomach cancer or who died from stomach cancer, if you look at the history very well, you realize it began with an ulcer, and this ulcer could have originated from an H. pylori infection, and H. pylori is a bacterium. What am I saying? I'm saying that kindly, can you know that we have a bacterium known as H. pylorus in singular or H. pylori in plural? And this bacterium can be killed, and you kill it using medication. The medication that kills bacterium is known as antibiotic. So there are antibiotics that can kill H. pylori. And it is not only one, it is a combination of 3. So if you combine these 3, you can easily kill the bacterium. We have what we call clarithromycin, we have what we call amoxicillin, and we have what we call metronidazole. If you combine these 3, you will kill the H. pylori. How do I use this medication? Don't go buying these medications separately. There is a kit that has all of them. So that kit is called H. pylori kit. It's available in all pharmacies. The only difference you could get is, instead of I've said we have clarithromycin, amoxicillin, and tinidazole or metronidazole. So instead of metronidazole, others will use tinidazole. Instead of metronidazole again, others will replace it with omeprazole or esomeprazole. Amoxicillin can also be replaced, but there are different companies that have the H. pylori kit. And this kit, as long as clarithromycin is there, that is the most important medication. By that I don't mean you just go buy clarithromycin and you begin using. Go for H. pylori kit for you to treat this H. pylori once and for all. It is then that you need to think of ulcers. After that, you have killed the bacterium. You are now free to use esomeprazole and omeprazole and acids to elevate the acidic condition within you. So that is all we had today as KAREEM'S Clinic, and thank you for listening.